I wanted to reflect a little bit on a patient interaction that I had where the patient was referred to me for a consult. They were interested in losing weight. They were a post bariatric patient from like a long time ago, but they had developed like a disordered eating habit, which clinically could have also potentially been an eating disorder. Anyway, the bariatrician had set out to say, why don't you follow up with the dietitian here at the clinic and the behavioral health specialist here at the clinic as well. And the idea was to help kind of suss out if this was a disordered eating pattern or if it had maybe morphed into an eating disorder. I don't necessarily treat eating disorders in that clinic in general, but I can assess for them. And then once we kind of evaluate what it could be, I then would make my recommendations. And part of that is also that the dietitian has their consult and she would assess for an eating disorder or disordered eating. We'd kind of come together, we'd gab like gals do, and then we would decide, okay, do we both think that this is one thing? Do we think it's another? Are we on different playing fields? And then we would refer the patient to an appropriate specialist. Eating disorder specialists are super, super specialized, and I love all of you, both in terms of the mental health providers that do it as well as the nutrition dietitian providers that do it. And I lean to you all as the experts constantly to help my patients. If it's disordered eating, like I can see that it's more motivated in the context of you're just trying different things on in terms of diets or what have you to lose weight. And it's more of a like, I tried this, I tried that, I tried this, I tried that, I tried this, I tried that type of scenario. Then I can work with you on that because then a lot of it is coming in as me and the dietitian doing a lot of education on different things, patterns, making health behavior changes, which I do a lot of health behavior counseling, setting up routines and things like that. But if it's truly an eating disorder, then I refer out to the specialist and let them help to offer whatever the supports are. And luckily, in the area where I work, we have a thriving program. Not where I work, but in the area that I work in, where we can refer out to. They do residential, PHP, IOP. Anyway, it was a long wind. Anyway, sidetracked. ADHD for a second. So the patient got into the consult, started off good. We were, getting some demographic background because when I make referrals to a program, to a provider, to what have you, I want to make sure that it's going to be a good fit for my patient. I'm not just going to ask you 4 questions and then give you a bunch of referrals where none of them might fit, your personality, your schedule, your activities of daily living, your work schedule, any of those things. If you are looking for someone that's male versus female versus this versus that, like I like to have all of that or as much of it as, patient's willing to share so that I can match you with as close to that ideal picturesque provider you have in your head. If I can get as close to that as possible, I want to be able to do that. And I'm reflecting because the patient got into the consult, started good, and then started questioning everything. Why was I asking about substance use? Why was I asking about trauma? Why was I asking about smoking? We paused maybe like 15 minutes into the consult, and I said, I am sensing that maybe some of these questions are either uncomfortable or awkward. Why don't we talk about it? Try to dive into it, maybe peel it apart a little bit to see if there was something else going on. There's a lot of stigma with mental health, especially for people of color and things like that. So I always want to be respectful. And if the patient wasn't ready to have the consult or appointment or maybe wanted to stop, I wanted to respect that. The patient got more combative when I asked about that. And it was something that I had not had occur before. So I'm, in new territory with just somebody kind of coming at it from that perspective. And so patient requested to continue with the consult. So we continued, got another section of the way through, and then still felt like, well, why do you need to tell me about these questions? And why do I need to answer them? And what does that have to do with XYZ? I had, explained what it is that I was trying to assess from the perspective of the behavioral lens, whereas the medical provider who may have asked similar questions was looking at it from a medical lens, and that the dietitian may ask similar questions but is looking at it from a nutrition dietitian lens. And so that if it seems like it's repetitive, even though we may have documented it in a previous note from another provider, the lens we're looking at it through is going to be a little different, so the questions may be formulated differently. End of the day, the patient got very upset, had lots of fun things to say, and that's not to say that I don't necessarily, understand that they might not have just been in a space to have the consult. But I want to say a couple things. We want to be compassionate. We want to be empathetic. We want to be understanding. As mental health, behavioral health providers, we may have patients who are just not quite there yet, even if maybe they did get the explanation from the other provider who referred them that this is what this was for. Some just aren't ready, and that's okay. The other side of this is I also want to encourage from a safety perspective that providers also make sure that you take care of yourselves. When a patient is upset, and this person was not necessarily like, being overtly disrespectful, like cursing, yelling, screaming, anything like that. but I could tell we were kind of doing circles around answering the questions. There was some comfort level that might not have been there in that same way. But for the patients who escalate well beyond that, please make sure that you protect your own space as well. And that safety is important for you. Your emotional safety is important, right? So make sure that you reach out to a supervisor or your manager or, whomever you feel comfortable within your organization to kind of say, hey, this is what happened. How do we move forward? What should we do? Like, what are the safety implications for everybody that's involved because patient X did Y or patient X said Y? We need to be able to protect ourselves just as much and our own mental space in the same way that we are the first to protect our patients' mental well-being, emotional well-being, and space. We want them to feel safe, but I also just want to remind you all not to forget about yourselves in any of this, and that it is okay to make sure that somebody is aware that you dealt with this, and how can we maybe figure out a way to be a protection for us in the future if it happens again. Again, this patient was not overtly combative, but I just also realized that there's a time and a space for us to have these discussions. And sometimes I think in maybe the behavioral health spaces, because we do so much protecting of our patients, that sometimes we forget about making sure that we protect ourselves. And we have to be able to do that, because if we don't, we won't be able to do the wonderful things that we do for our patients. So make sure that you are protecting yourself and your space. Do not be disrespectful or unempathetic to the patient that you're working with. But, when the session or the encounter that you're having with that person ends, take a step back. Where are you at? Read the room. What do you need? Do you need to take a lap? Do you need to take a breath? Do you need to vent? Do you need to listen to a podcast? Whatever that is, so that way you take care of yourself and you can kind of reset and either be fresh for the next person, or if that was the last patient of the day for you, be fresh for the rest of your day or tomorrow's patients, any of those things. But don't leave yourself in that space to just sit there and kind of stew, because that's what happens. That's what happens. And then that's where burnout can start to set in, or resentment towards a job or a place setting, or things like that. And we never want that to happen. So just a gentle reminder, a very long-winded one, but take care of yourselves. Happy Friday.